Welcome to the Caregiver Reality Show with your hosts, David Levy and Paul Vadiato, who bring you more than a combined 25 years of practical experience, helping thousands of family caregivers, helping them find solutions to the challenges and frustrations presented by this important responsibility. So if you are in the position of caring for a spouse or a parent, a loved one who is no longer able to care for themselves, or if you know someone who is, this hour will be worth the listening. Now, let's tune in to today's edition of Caregiver Reality with your hosts, David Levy and Paul Vadiato.
And good evening, South Florida, America, and the world. It's Tuesday at 5 o'clock, and this is the Caregiver Reality Hour. We're happy to have you back with us, and we know you're coming back and back because the numbers are really jumping. And we're very pleased to see that. And between listeners and viewers, we're getting into some pretty significant numbers.
No shortage of caregivers.
No shortage of caregivers, and while that's unfortunate, I guess in a kind of a strange way, that's not so bad either. All right, but to all of you out there who are caring, see it coming, we're glad to have you with us, not because you're a caregiver, but we have a lot to talk about, and much of it will be things that will interest you, whether you're a caregiver now or you're a caregiver going forward. You're listening to us on the CaregiverReality.com radio streaming video. You're listening to us on iHeartRadio. You're hearing us in South Florida on WWNN 1470 AM or WWNN.com, and AMP2.TV, who is our producer. So you have no reason not to watch, listen, no excuse not to hear us. And tonight we have a very special guest. Her name is Donna Baldwin. She is an attorney, and she has some really interesting things. She's an employment attorney, and things that relate to employment discrimination, as it relates possibly to caregivers and others. So it's well worth the listen. And as we do just about this time every week, Paul, how was your week in caregiving?
Well, good evening, everyone, and thank you once again for joining us today. Appreciate you listening in and being part of our experience every week. Things are looking a little bit better. We had a very good week. My bride, Debbie, seems to be coming along. Problems are starting to clear. Some answers are starting to come about. But you know, for those caregivers out there, you'll understand. It's sort of like waiting for a shoe to drop, because she's feeling so good, it's like you're walking on eggshells. So it's hopeful optimism. I think we heard the phrase once before.
Cautious optimism.
Cautious optimism.
Right.
How's Suzette doing, David?
It's hard to tell. You know, she's still not back in her right cycle yet of sleeping and awake at the right times. And so I got to tell you, this morning, I got up about 6:30, fed the dogs, did 3 loads of laundry, folded all the sheets, emptied the dishwasher, took out the garbage, because it was collection day, and I got to tell you, I'm getting pretty, and fed the outside cat. And I told Stella tonight, she's our cat, I'd give her a shout out. Stella, you're very lucky that you live in a Jewish driveway that feeds you. And but to my 4 dogs, who really don't know what's going on anymore, I thank you guys, because you keep it all moving forward with Mom. And you know what the cautious optimism is? We didn't have any catastrophes, so I consider that so far to be a good week.
And there was no 911 calls. So
no 911, and actually, and to all our Jewish listeners, I want to wish you all a very happy holiday. And tomorrow night, even though I live in a Lutheran family with Catholic in-laws, I'm going to Rosh Hashanah at one of their houses. So this should be very interesting.
Well, you have a happy holiday.
Yeah.
David, I do want to thank our listeners for all of their participation on our Facebook page. So many of you are commenting, joining in the discussion, and our are submitting ideas as to the kinds of things that you would like to see there. We want this to become your page, and we're sort of the conduit to getting the information that you want. So again, thank you to our loyal fans, and thank you for so many of you who participate with emails and questions along the week.
Yep, and we get them through the website. We see them on Facebook. I get phone calls, and so we're dealing with your issues as quickly as we can. We can't get to all of them. For those of you that go to the website, you can purchase the updated 2014 version of the 2013 Florida Council on Aging award-winning caregiver manual, and it's available at a very reasonable price. You can also get the 2013 award winner on Kindle. Just go to Kindle and put in David Levy Caregiver, and surprisingly the book will pop right up, because we're getting a lot of attraction on that. And so I thank the viewers, and I hope that they're getting as much benefit as I believe they are.
Well, David, it's not a how my mother, I took care of my mom kind of a book. It really is a problem-solving manual that when you're facing something that you're not sure what to do, you can go back there and come in, get some ideas, and help stir some thought. That problem-solving piece is just so brilliantly written.
That's the thing. I'm sorry, Paul, I didn't mean to talk on top of you, but practical problem-solving is really the issue in caregiving. Yes, there's 15% of what you need to know about the disease for the person that you're taking care of, but the rest is the system. And how do you fight the system or get into the system? What legal documentation do you need? When, what changed? Why do I need it? What's going on in a whole array of things? And everything is ever changing in the world of caregiving, not just the clinical side, but everything. And not only that, but as I continue to point out, our facilities are shrinking. We don't have the nursing homes that we used to. And when people are saying, I'm going to put my loved one, when the time comes, through Medicaid into a nursing home, you may just discover that nursing home bed, whether it's Medicaid or whatever, isn't available. I mean, they're shrinking at a pretty rapid rate. We have lost 20% of our nursing home beds in the last 4 years due to the fact that most of them were built back in 65 and 70 during the Hill-Burton Act following the passage of Medicare, and they're functionally obsolete, and there's no bottom line when most of your census is Medicaid. And so it's not fun to be in a business that loses money.
Going home.
And the more we see Medicaid kind of advantage programs that have been created to manage Medicaid in various states, it's one more mouth in the middle to feed. And so it's getting ever harder to drag out a bottom line. And I pulled something out of that was online yesterday that I found very interesting. It was in Florida Healthcare, and it said, patients getting stuck with the ER bill. Even with in-network hospital insurance, it may not cover the ER physician. And this was in the Tampa Bay Times, and they went on to say that one of the largest companies here in Florida and nationally, because most hospitals subcontract the ER capability in their hospital so that somebody else is paying for those specialists and manning at 7/24. Well, just because they're in that hospital does not mean that they are approved by your insurer as being part of their panel. Yes, the hospital is. Yes, if you get admitted to a bed, they're part of what they will pay for. But big companies like United Healthcare, Cigna, Aetna, Humana do not necessarily cover that private contractor. And so you can wind up leaving the ER and a few days later getting a bill for $900, $1,300, $1,400. You call your insurer and they say, yeah, you were covered for the hospital but not for the ER. Well, why didn't you tell me? And the answer usually is you didn't ask. So now that's a good question to ask, is whether or not the ER provider for the hospital, not that you have a big choice in the matter when you push 911 as to where you're going, but the assumption has always been that if you wound up in the hospital and they were on the approved list, you were covered. So I would give my provider a call and say, this is the hospital in my local neighborhood, and are the ER physicians covered by you, or are they out of network? Are they
Medicare.
off panel? That's exactly right. And so it's an important question to ask. And the Kaiser Family Foundation kind of chimed in that this notion of consumer choice just falls apart when it comes to emergency services. And what this is called it's called balance billing. And what that means is that if you're treated by a doctor who's not in your insurance network, he's not obligated to agree to the same rates as your in-network provider. So your plan may pay a certain amount for doctor fees, and then the doctor who is out of network has every right to charge you for the balance of what their usual and customary is. And when you look at ER charges, they're expensive. Those are skilled people using a lot of expensive equipment. And so, word to the wise, ask so that you know. It's not that you necessarily have an opportunity to pick where your disaster comes from, but you ought to know what you're getting yourself into.
Well, move it away from, the Palm Beach areas where we're more metropolitan. You think other parts of the country where there are fewer choices, or maybe one hospital that covers 30 or 40 miles. There is no shopping, there is no choice.
Right,
That's
and
where you're
more than
going.
likely they're using a contract service because they can't attract to the boondock hospital. And I mean, the rural hospital, the kind of, pay the kind of money and have the kind of coverage that an ER specialist demands and needs.
And David, that really goes back to what we were talking about a few weeks ago with Dan McGrath, when people vastly underestimate what their medical costs are going to be during their retirement years, taking into account co-pays, co-insures, and now a new one, things that you thought were covered that really aren't. It's a scary situation for somebody who is retired and living on a fixed income.
Oh, yes, and especially when Dan was discussing that trade-off in Medicare when they start to begin to means test it, looking at your income, and the more you have, the less you might get, or the bigger the premium that you're going to pay for Part B, and that comes right out of your Social Security check. So it's going to be a very tricky game, and that's what I talk about when I say the system. This is not something that you can go back typically to your doctor or your lawyer or the Indian chief, so to speak. This is something you're going to have to figure out on your own, is how are you going to do it for you and your loved one? And when I talk about the shrinking beds, all right, in nursing homes, the consequence of that is if you're not going to get into a nursing home and you can't afford assisted living, which is getting more and more expensive by the day, and even though we have great assisted living sponsor in Arden Court, who's a phenomenal dementia care facility, they're not cheap. And over time, there's a lot of money that goes out to these facilities. And so if you can't afford that, you know what's going to happen. It's going home. And you are the chief nurse, the resident, and the staff doctor, as well as the caregiver, who may also have a job over and above caregiving, like I do, like Paul does.
And now we're in the workplace.
And now we're in the workplace, which Donna Ballman is going to tell us all about very soon. But I mean, these are the issues that really get down into the nitty-gritty of caregiving. It's how do you survive in an ever-changing world of healthcare, practical care, and using skills that you didn't really learn, and in a process that is very counterintuitive. Just when you think you understand things, they go the other way because you didn't understand the system well enough to see what was coming down the track, and it's something where you have to be out there every day, looking, watching. That's what we do. So at least when we get on the air, we give you the most up-to-date information that we think is relevant and that we've checked out and that makes sense. And this last couple of weeks since the Institute of Medicine came out with their report on death and dying in America, we have seen all over the internet the fact that these conversations, just as death over dinner has gotten a real buzz, the time to talk about these things is after Thanksgiving dinner, meaning when the family is around, so that we understand what do you really mean when you're talking about your advance directives, so that nobody, in the words of football, calls an audible and changes when they're in charge as substituted judgment under an advance directive and decides you really wanted me to pull out all the stops, Dad, even though you said something different in your directive.
But
And
that's my father.
yeah.
That's the
All right,
the argument.
and that's my dad, and I'm going to do everything I can, even though when you really weigh it, as I tell our audience every week, okay, so we keep him alive another 3 weeks, another 3 months. What's the quality of life? Where's his dignity? And are we not going to see the same thing all over again in that space of time? And so you really have to give it a lot of thought. And not only that, look at the expense of going through what I call medical heroics. And one of the things that the Institute of Medicine brought out is that doctors, not the death panel version that scared everybody a couple of years ago, but doctors really who are there to save your life, create a cure, are not comfortable talking about death and dying and end of life. One thing when you find a palliative care doctor because you've got hospice or somebody else, a geriatric physician who's been a little more trained in understanding that there is an end to life without having to go through hoops and whistles of the latest and greatest. And you have to be the one in control, because left to their own devices, from a liability point of view, and I think Donna will bear that out, doctors are going to do everything they can not to have somebody come back and say you didn't do everything, in the absence of there being documentation and the person speaking on your behalf authoritatively saying, no, stop, this is not what it says, this is not what we want. And so this is something that, everybody has to be aware of. And Paul, when we come back, we're going to take a station break. You've got some really interesting questions to ask Don, and I'm looking forward to hearing them as well. So let's go to our break.
CFC support helps fund research. You can too. Each year, thousands of men and women serving their country in the U.S. military, as well as other employees of the federal government and the U.S. Postal Service, provide support for medical research to find treatments and cures for diseases. This is done through the Combined Federal Campaign, an annual workplace giving campaign that allows eligible individuals to support charities, such as those that conduct medical research, through a payroll deduction. Money donated this way to the medical research charities and its member organizations helps fund research to fight diseases from Alzheimer's to cancer, multiple sclerosis, blindness, breathing disorders, and much more. The diseases included afflict people of all ages, from the very young to the very old. You don't need to be a member of the military or a federal government employee to support research to help you or those you love that are suffering from an illness or disease. Donations to our not-for-profit tax-exempt organizations are tax-deductible and provide a vital source of funding in the fight to defeat some of life's most dreaded diseases. Please visit the website of the Medical Research Charities, which can be found at medicalresearchcharities.org. That's all one word, medicalresearchcharities.org. On that website, you can learn more about our member charities and make a donation in support of the research they're conducting for a specific disease or family of diseases. You can make a donation to Medical Research Charities itself and support the work of all our member charities. Please visit our website today, medicalresearchcharities.org. Become a part of Joining Forces to Find a Cure. Are you a family caregiver? Are you taking care of a spouse or loved one who can no longer take care of himself or herself? Are you dealing with Alzheimer's disease and don't know what to do? Do you feel burned out, frustrated, and just don't know where to turn? You've tried doctors, lawyers, and mental health professionals and have come to realize that they don't have practical answers to these questions. What you need are experts, non-clinical family caregivers with 25 years of active experience helping thousands of family caregivers like yourself. People who can help you provide a better quality of life for yourself and your loved one. Who you need are David Levy or Paul Vadiato. Reach David at david@caregiverreality.com or reach Paul at caregiverreality.com and let them help you pick the right path towards improving the quality of life for you, the caregiver, and your loved one.
This is Paul Vadiato, co-host of Caregiver Reality Hour. As a spousal caregiver, I know that sometimes things get rough and sometimes we lose perspective. David Levy and I have over 50 years' experience and expertise on advising caregivers. If you find that you need help, you're a little confused, reach out to us at Paul or David at caregiverreality.com. We're there to help.
This is Caregiver Reality with gerontologist David Levy and caregiver expert Paul Vadiato, who ask you to call in and speak with him on the air toll-free at 888-565-1470. That's 888-565-1470 to share a story or important information. Now, back to today's Caregiver Reality Show.
And we're back just as promised. And medical research charities who you hear every week, we run their advertisement or their good word, and they're out there. You know, this is the season for making your tax donation, the one you can get, credit for. And medicalresearchcharities.org has got 29 underlying organizations. And this week I have chosen to speak of the Alzheimer's Research Center of America, and they have scientists there, as many other places do, that work tirelessly to find new treatments. I was talking with somebody today in one of my support groups and says, is there nothing on the horizon? Is there nothing new? And unfortunately, there really isn't anything substantive. We're not going to see a cure for this disease for a long time. And the work that Alzheimer's Research Center of America, which is under the umbrella of Scripps Research, these folks are working daily with everything that they can to try and find some breakthroughs. But right now, the only thing we can do is be preventative and try and keep ourselves in good health, try not to put ourselves in compromising circumstances that causes our brains to become inflamed or to push the progression. And at some point, maybe some of these drugs will work if we can intercede earlier in the process, which means before we actually see the Alzheimer's or the dementia, can we delay it or turn it around? And that will, when that day happens, there'll be a very long line for that drug company. But Alzheimer's Research Charity, their goal is to develop, as I said, new therapeutic strategy, early disease with biomarkers, effective drugs, and they're out there pushing for everybody every day. And if you want to make a contribution, it's www.alzheimersresearchcenter.org. That's Alzheimer's with an S on the end, researchcenter.org. And now, Paul?
Thank you, David. And MRC, just great.
Yep.
And please dig deep. It's certainly a worthy
Right.
cause.
You give to them and you give to 29 worthy charities at the same time.
Exactly. David, I'm really pleased with who I'm going to introduce today. We try to find really subject matter experts to help our listeners decipher some of what's happening in their lives as caregivers. And Donna Ballman, I'm going to just read her bio because it's like...
You didn't memorize it?
No, I can't remember that many lines. She's just terrific. She's an employee-side employment lawyer practicing here in Florida. Her book, entitled Stand Up for Yourself Without Getting Fired, Resolve Workplace Crises Before You Quit, Get Axed or Sue the Bastards.
I love that.
And it was the winner of the law category of the 2012 USA Best Books Award and is currently available for purchase. She's been practicing employment law, including negotiating severance agreements and litigating discrimination, sexual harassment, non-compete agreements, and employment law issues in Florida since 1986. I can't believe that.
No, me either.
Her blog on employee-side employment law issues, Screw You Guys, I'm Going Home, name of the blog, was named one of the top law blogs in the country, including Paralegal 411 Top 25 Labor Employment Law Blog, Nexus Lexus Top 25 Labor Employment Blogs. She writes a weekly column for AOL Jobs and has written for the Huffington Post on employment law issues and numerous other publications.
No wilting flower, Donna, huh?
You get old, you get some stuff done.
I don't know how you have time to practice law every day, but
I wonder that myself sometimes.
thank you so very, very much for being part of our
Right,
program
and making
today.
the
Well, thank you
long
for
trek
having
from
me.
Miami to Boca Raton.
It's a pleasure to be here, really.
Well,
I
we're
think it's a
glad to
great
have you.
topic.
All right.
So, Donna, if you would just take us down a very simple road to start with. What exactly is employment law, and what is it you do, and who might actually use your services?
Well, I do employee side employment law. So, employment law, it sounds simple that I represent employees, but it's really not that simple because things like sexual harassment, discrimination, negotiating severance agreements, employment agreements, defending against non-compete agreements. Those are the kinds of things I do. Whistleblower retaliation, family and medical leave. But what I don't do is labor law, which is really union stuff. So stuff involving you and your union or organizing a union. I don't do that. I do some stuff with National Labor Relations Board relating to non-unionized workplaces. There's a lot of rights that non-union employees have, and they don't necessarily know about that. And then there's this other thing called workers' compensation, and that's a whole different set of attorneys. So that's not employment law. So if you got workers' comp, that's a workplace injury. You need a workers' comp lawyer. If it's a union, you need a labor lawyer. But if it involves pretty much anything else relating to employees, that's me.
And
Okay.
discrimination meaning what?
Discrimination is not just discrimination based on you being you. I wish that was illegal, but it's not. Discrimination is race, age, sex, religion, national origin, in Florida, marital status, one of those protected categories. That kind of discrimination is illegal, and there are a couple of things that are illegal discrimination. Examples are you're treated differently than others under the same circumstances, and those people are in a different category than you. For instance, if you're singled out because of your caregiver responsibilities, okay, well, caregiver isn't a protected category, but sex discrimination is. So, as a good example for discrimination for the caregiver, let's assume that somebody doesn't want to hire a female because they assume that she's going to be the caregiver of the family. That would be sexual stereotyping, sex discrimination. On the other hand, if you have a male who has caregiver responsibilities and the employer says, well, you're not the one that should be doing that, you should have your wife or sister or somebody female doing that, then that could also be sexual stereotyping. So that's a good example of discrimination for caregivers.
Well, that's interesting because more and more men are becoming caregivers that are still in the workplace, and a lot of it has to do not just with your mom, it has to do with spousal caregiving as more and more people become disabled and get into chronic illnesses in their late 50s, early 60s, and the spouse is still in the workplace.
Absolutely, and men are, you can be in that sandwich generation, or you could be taking care of a spouse or an ill child, and you do have rights in the workplace. You don't have a lot in Florida, but there are some rights, there are some laws that protect you, and I think it's really important that you know what those are.
Well, as a spousal caregiver, I've been complaining to Paul, because he's my boss, that he picks on me because I have to leave early or come in late.
Well, I thought it was the dresses, David, but that's okay. On a more serious note, Donna, we hear Florida being described as a right-to-work state, and I don't know if that's the correct term, but what exactly is that, and what exactly does an employee, what are they entitled to, and what does that mean exactly
Okay.
for
Well,
them?
a lot of people say Florida is a right-to-work state, and it is. A right-to-work state means that they can't force you to join a union, basically. If you're in a unionized workplace, you don't have to join the union to become employed, and they can't make you. But Florida is also an at-will state. And at-will, every state in the union except for Montana, interestingly enough, is an at-will state, and that means that you can be fired for any reason or no reason at all, except for an illegal reason, like discrimination, like retaliating against you for taking family and medical leave, like making a workers' comp claim. Those are things that might be illegal reasons.
Okay. Under the family-related discrimination laws, we have laws that exist on the federal level, and there's laws that exist on the state level, and I assume that's true in every one of the states. What are the protections that federal versus state?
Okay, well, federal law, you've got certainly discrimination, and we talked about that. Age is another one. Disability discrimination, you also can't be discriminated against for being associated with a person with a disability, so that's one of those things that protects caregivers as well. Federal or state law, here in Florida, you have the Florida Civil Rights Act, very much parallels the federal discrimination laws, with the exception that we also protect people due to marital status. So because of the fact that you're married or unmarried, you can't be discriminated against. But otherwise, it's very similar. It covers employers with 15 or more employees. Then we have some counties like Broward and Dade that cover employers with 5 or more employees. So there are also local laws. Some states have additional protections. For instance, some states have a Family and Medical Leave Act that protects employees in smaller workplaces. Florida does not, but we do have some counties that do. So it depends on the state, it depends on your locality, there can be additional protections.
Okay. David and I do consulting towards the workplace as it applies to caregiving. What would you like to see employers begin to do to become more caregiver friendly from your perspective as a plaintiff attorney?
Well, I'd say first of all, stop breaking the law.
Just go into detail on that.
I started doing employment law 28 years ago, and I thought, well, I'll do it for a little while, and then everybody will understand the laws, and then I go do something else. Well, 28 years later, here I am, and you still see some blatant violations. One of the groups that gets targeted a lot is caregivers, and you get people targeted because employers think that they're going to raise insurance prices, especially as we are approaching the employer responsibilities of the Affordable Care Act. We see employers looking to get rid of employees who they think are going to raise insurance prices, and that includes people associated with people with disabilities or with serious illnesses, but also your own illnesses. So I think that stop targeting people illegally, but also you've got to think in the long term if you're an employer. Right now we are definitely in an employer favorable work environment. But if you look back 20 years ago, back in the 90s, 80s, where it was more the employees had a lot of choices, and employees could pick more friendly employers, then those employers that had better benefits, had better leave policies, were the ones that the best employees went to. So I think that employers need to think about the long term, and instead of cracking down on those people for taking leave, let's talk about why don't we take care of our employees? Let's try to keep people for the long term.
And that's part of recruitment and retention, is to
Exactly.
be a friendlier employer.
Right now you see a mentality, let's get rid of them because they're costing us money or they're taking too much time off. But you want to keep your good people. So if you're cracking down on anybody who takes time off, then you're going to lose a lot of good people.
What about education? Do you see a lot of education in the workplace as it applies to informing people of their rights, things like caregiving, things like discrimination? I know a lot of companies have employee assistance plans, and they say, well, that's going to take care of what my issues might be.
Well, there are some employers out there that are terrific. They
Sure.
make sure that people are educated, what is discrimination, what's prohibited. They have manuals that are well drafted, but then there are a lot that aren't. The manuals aren't well drafted. They just cut and pasted something from the internet. It's not tailored to that workplace. I've seen some employers, and this still astounds me, that have people sign saying they received the manual, and then they hide it. Oh, well, you don't get a copy. You can't take it home, but you'll have a copy in HR. In HR, and that's it. So you don't know what your rights are. You don't know what the policies are. You don't know what the policy is if you have to call in because you were sick. You don't know what the policy is to follow if you have to take family and medical leave for a caregiving responsibility. If you need intermittent leave, you don't know what you have to do. So
But you do
keep
have
it a
to make
mystery.
them aware.
Yes.
And so that puts you behind the eight ball to begin with.
Employers have to inform employees, particularly about family and medical leave. There are specific notice requirements, but a lot of employers just kind of have it all be a mystery, and they'd rather people not know. And if I'm the employer, if I'm HR, I want people to know what their rights are and also what their responsibilities are, because you do have responsibilities under family and medical leave, notifying your employer, jumping through certain hoops as far as getting medical certifications. So you want to make sure that people understand their rights and their responsibilities.
Can you explain what that medical leave is and how it works?
Family and medical leave is the federal law that applies to certain employees. If your employer has 50 or more employees within a 75-mile radius of your work location, then the employer is covered. And if you've worked at least a year and work at least 1,250 hours in that calendar year, then you're entitled to family and medical leave. That means you get up to 12 weeks, and it can be paid or unpaid. It's paid if you have accrued PTO, vacation time, sick
Paid
leave.
time off, PTO?
Yes, PTO is paid time off, so vacation and sick leave. If you have accrued time, then they have to pay you. And then after that, it's unpaid, so you get up to 12 weeks. But it doesn't have to be continuous leave. It could be intermittent leave. So say you have to take your mom or your spouse to the doctor once a week, or for dialysis or whatever it is. You have a regular appointment that you have to keep. You can take intermittent leave. So you put in and you tell them, these are the appointments I need, and then it doesn't have to be even regular. If you have a condition, or your spouse has a condition, or a family member, a child has a condition where they could need intermittent treatment, but maybe they don't need it right now, you put in for that leave in advance, and then you've got it covered, and it's up to 12 weeks total. So if you miss a half day here, a half day there, or a day here, a day there,
So
then
that's
you're covered.
12 weeks in the calendar year. So it renews itself
Well,
annually or no?
It's 12 weeks in a 12-month period, and employers do it differently. You can do it a calendar year, you can do it a rolling year. So like, say you started your leave April 1st, then it rolls over to the next April 1st.
Okay.
And then it starts over again the following year on April 1st.
In an aging workplace where your knowledge workers and your vested employees, so to speak, are getting older, but they need to maintain work, as obviously in order to continue to build their nest egg, as it were, make sure that retirement, which they never planned on to be 90, continues on. Doesn't it kind of leave the employer with a little bit of an enigma in that, they want the productivity, but they don't necessarily want the responsibility?
Now, I think that there's a perception out there that older employees miss work more and cost employers more money, but I think that's a mistake, because older employees tend to be more reliable as compared to, say, millennials. No disparagement on millennials, but you've got a work ethic that maybe you don't have in younger employees. So I think that you've got older employees with the experience, and you've got to have somebody there that kind of is the historian. They know what happened 10 years ago, they know what happened 20 years ago, so you don't repeat the same mistakes. So I think having older employees is a real advantage, and employers sometimes see the older folks as a liability, but they're also a real positive.
All right, so that's an ageism issue.
It is.
When we were talking earlier, Donna, we spoke about dads now taking, I guess it's paternity leave rather than maternity leave when a newborn occurs. What have you seen the reaction be among employers?
Well, some employers offer, well, you get this amount of weeks if you're on maternity leave and this amount of weeks on paternity leave. That's illegal. You cannot discriminate on gender. You have to give the same amount of time. So if you give a female 12 weeks to bond, the male is entitled to that as well. And family and medical leave says 12 weeks for either gender. But then there's pregnancy discrimination laws obviously apply to females. There's also pregnancy also covers for adoption.
That's what I was going to ask.
There are certain laws, protections there, and certain conditions associated with adoption that can be protected. Family and medical leave definitely protects for adoption for both genders. So I think that you've got sexual stereotyping that, oh, well, men don't need as much time to bond with that newborn. Well, they do, and they're entitled to it. So if you have a male who wants to take those 12 weeks off, you have to give it to him.
There's an alphabet soup of agencies and whatnot that are really involved in the work that you do, that are out there to help protect employees. EEOC comes to mind. Can you talk a little bit about what these agencies, what they are, and what they're supposed to be doing?
The EEOC is the United States Equal Employment Opportunity Commission, and they handle discrimination. They can't award you money, but filing with them is a prerequisite to filing a lawsuit. So in Florida, you have 300 days from the date of discrimination to file with them. It's called a charge of discrimination, literally a single piece of paper. You also have the Florida Commission on Human Relations, which is the state agency that does the same thing. So in Florida, you've got the two agencies, and in most states that have the two agencies, the state and the federal, you have 300 days from the date of discrimination to file literally the same piece of paper called a charge of discrimination. You check off the box that you also wanted to go to the state agency, and that's a prerequisite to filing a lawsuit. They can't award you money, but they do have a nice mediation program. They do an investigation, and at the end of that, they're going to decide, do you have cause for the charge of discrimination, or are they unable to determine whether cause exists? That's probably 99% of the time that they're unable to determine. Either way, you're going to get the right to sue at the end, and you're going to have the right to file a lawsuit.
So they kind of do the front work for you in at least making a determination based on what they see, as well as possibly evidence gathering.
Right. So they don't say that you don't have cause. And for the Florida Commission on Human Relations, they have cause or no cause, but the Equal Employment Opportunity Commission just says cause, or they're unable to determine whether or not cause exists, which is the more accurate finding. Basically, if there's disputed evidence, they're not going to find cause. They're going to say, look, take it to a court and let the court decide. There are also opportunities to resolve it. They have a terrific mediation program where I tell people, look, say you want to mediate. If the employer says yes, then everybody sits down and tries to settle it. It's a great way to try to resolve a workplace dispute. Mediation. Some of the other letter agencies, DOL is the Department of Labor. They handle things like wage and hour disputes, failing to pay overtime, failing to pay minimum wage. The NLRB is the National Labor Relations Board. People think of them as handling union issues, but they also handle non-unionized workplaces. If you are an employee of a non-government employer, and you're not a supervisor, you're covered by the National Labor Relations Act, which means that you cannot be fired for discussing working conditions, comparing wages and benefits with coworkers, complaining on behalf of coworkers and yourself regarding working conditions. So there are some protections there. They can't stop you from comparing, and some employers have policies. Oh, you cannot discuss your pay or your benefits. Well, that's illegal if you're not a supervisor.
Gotcha.
I guess that's for whistleblowers also.
The National Labor Relations Board doesn't really handle whistleblowing, but certainly one of the ways that you can find out whether something illegal is happening is to discuss it with coworkers. So yeah, it also protects things like sexual harassment. If you're a victim of sexual harassment and you're talking to coworkers, did he or she do this to you too? That you're protected. You're allowed to have that discussion.
Donna, we often say here on the show that as a caregiver, you can't leave it at the door, so to speak, when you go into the office or you go into the workplace. If I'm working and I feel that because of what I need to do to take care of my wife that I am being discriminated against, how do I handle that? Who do I go to? What do I say? Because our listeners are out there and they're living this every single day.
Well, I think first, I always tell people, figure out a way to complain where you're legally protected. If you're just saying, I'm being harassed, or I'm in a hostile environment, there's no protection against retaliation for that. But if you say, I am being harassed because I am being singled out due to my gender, because my supervisor doesn't think men should be having caregiver responsibilities, then that is a complaint where you're legally protected against retaliation.
Mm-hmm.
Family and medical leave. As soon as you know that you're going to have a surgery, or your family member has a condition, or you're going to need to be a caregiver with responsibilities, put in for that family and medical leave. Then you have some legal protection. You cannot be retaliated against for taking family and medical leave, for putting in for family and medical leave. So I always try to say, let's figure out a way where we can complain that's legally protected. Otherwise, you're kind of at the mercy, and if they want to retaliate, there's not much you can do.
Donna, let me ask you this question. Recognizing that it's a 12-week maximum period of time in any 12-month period, what is the position that you hear from an employer who says, hey, I can't go without this person for 12 weeks. I got to hire somebody to cover that gap. And when my person comes back, or the person that's out on family medical leave, I can't keep employing both of them. And in the meantime, the person that I got up to speed, I just spent a lot of money on. And the person that's out on leave may have missed a bunch of things in the flow. So how does something like that get resolved?
If you've taken family and medical leave and you're actually protected under that law, your employer must restore you to the same or an equivalent position when you return. An equivalent means hours, pay, benefits, location, all of that stuff. So they can't say, oh, well, now you're the janitor. That's not an equivalent position unless you were the janitor. Mm-hmm. So the employer, as much as they might want to keep that replacement person, they cannot. But a lot of employers will say, well, let's try to figure out a way to get rid of them. So sometimes employers will scrutinize, well, let's dig through their email, let's try to find something that they did. And you are vulnerable when you're out of there, because if you've got an employer that wants to get rid of you, they can fire you for something other than your family and medical leave. But if they've targeted you for scrutiny that other employees don't have, just because you took family and medical leave, that could in itself be illegal.
Just being absent without a reason is not going to give you the protection.
Yeah, if you're absent with no reason, you're not protected. But if you take a family and medical leave, you've put in, say, for intermittent leave, your spouse has an emergency, you have to take them to the emergency room, you have to be in the hospital for a few days, that's protected. You need to notify them, though. You have responsibilities. You have to notify them as soon as you know. I mean,
Right.
obviously, if it's an emergency, you're in the
yeah.
ambulance, maybe you're not going to have time, but you need to take that responsibility and notify them as soon as possible. And I've talked to people, and they say, well, I was so traumatized I couldn't deal with it for a week. Well, you left your employer in the lurch. Called for a week? Really? You can't do that. You have to take that responsibility, and you have to comply with your obligations if you want the employer to comply with theirs.
Well, that seems equitable, but not always the circumstances prevail. As you just said, I can't do it immediately. I was shocked to find out my husband had a heart attack, and I've been running like crazy just to keep everything going, and it really was 5 days until I could tell them.
Well, I
guess
think
every
it's really hard
situation's
to
on its
argue
facts.
that it's reasonable to no show, no call for 5 days. I would say if you really have a situation like that, one of the things you might want to do is add it to your checklist of things to do. You probably have a checklist of things to take on the way to the hospital, the living will, all those things.
Advanced directives, right.
Take your employer's phone number and make sure, or email or whatever, and have a way to contact them and keep them updated as to how long it's going to be.
Before we came in, Donna, we were talking about the conundrum that potentially is going to exist here in Florida should medical marijuana become legal, and then you brought up issues that the Charlotte's Web,
Charlotte's Web is going to be legal.
It is legal.
Want to define Charlotte's Web for listeners that may not be aware?
All right, well, Charlotte's Web is basically a low THC. It supposedly doesn't give you the hallucinogenic effects that normal marijuana does, and it has some medical benefits. So it's going to be legal next year, but we have no protections in place in the law that made it legal for employees. And now in November, we're getting ready to pass, and I think it is going to pass. Regular marijuana is going to be legal if it's prescribed by a doctor, and there's going to be some hoops you have to jump through, but there's no protections for employees. I would say, wake up, legislature. Let's pass some protections for employees. In most states that have passed it recently, they've put in some protections for employees because early adopting states didn't have those protections, and they've had some bad case law come down.
And when you say protections, you're referring to the fact that an employer has a right to do a drug test or a urinalysis or a blood test to determine whether or not their employee is on some kind of prescriptive drug, non-prescriptive drug, illegal
And
drug.
Charlotte's Web, even though it doesn't have some of the mental effects, you're going to test positive. So you're not protected. Your employer can fire you for taking Charlotte's Web, even though your doctor prescribes it. Once medical marijuana passes in Florida, then you can be fired for that. There's no legal protection. They can, not even just a drug test. If you tell them, look, I'm under a prescription for medical marijuana, you're not coming into work incapacitated in any way or impaired, you can still be fired for that, just for doing it on your own time. And I think that's a shame, because people are under prescription codeine or taking over-the-counter Benadryl. How are you more impaired than somebody who's using medical marijuana off work hours? I don't think that's right, and it shouldn't be legal, but it's going to be in Florida unless we do something.
And that's really with the feds as well, correct? I mean,
Well, it's illegal under federal law, and so Family and Medical Leave and the Americans with Disabilities Act do not protect you if you are using medical marijuana. The Florida Civil Rights Act probably won't protect you, even for medical marijuana once it becomes legal. So we're going to have to fight. We're going to have to fight. And Florida is one of those states that's really backwards on employee rights. We are really one of the worst states in the nation for employees. So we always have to fight for those employee rights. So if you don't like that, talk to your legislators and say, what the heck were you thinking putting up this law, putting it on the ballot, and not protecting employees?
Is the Florida Bar active in affecting change?
The Florida Bar has been advising lawyers on, there's really some issues about ethics and whether lawyers can even advise people on medical marijuana, growing it, opening shops and things like that. And the Bar has been focusing really on what lawyers can and can't do because it's still illegal.
Donna, we have a caller. Jeff, are you there? Caller?
Calling David. Hello, this is Jeff Van Trees. How you guys doing?
Hi, Jeff. How are you?
Oh, good. I was just had a quick question for Donna. I was wondering if you could comment on the practice of many employers that utilize non-compete clauses with employees to put them in a defensive posture in the event that in a discrimination or wage loss or unpaid wage claim were to ensue. This might make the client potentially less desirable for an employment lawyer because now they have to do defense work in the event that there's an issue with the non-compete clause. So I was wondering if you could comment on that.
It's one of my favorite things to litigate, actually, is non-compete clauses, because Florida is one of the worst states in the nation for employees on non-competes. There are defenses that they have in other states, such as undue hardship on the employee, that we don't have in Florida. So it's a tough state, but there are defenses. The employer has to show a legitimate interest to protect other than preventing competition. I won't go into all the details, but they have to jump through some hoops if they want to enforce a non-compete. But yes, non-competes are being misused in Florida as a stick against employees. So sometimes if you have an employee who's, say, a caregiver or somebody who is in a weakened situation, whether they have a disability or associated with a person with a disability, it can be used to say, you can't move, and that person probably can't afford to fight. And that's the sad part about it. And so the employer, you're raising a discrimination issue, the employee's gone, and they say, aha, well, we're going to try to enforce that non-compete to keep the employee from working. Well, that's kind of a silly stance for the employer to take, because the damages go up on the discrimination claim if you prevent them from getting another job. So I say, stupid employers, why don't you let the person get another job so they can mitigate their damages? But the employee can really be out of luck because they're out of money. They can't afford legal fees. They can't afford those costs. Non-competes is one of those things that we really do need to reform in Florida. But if the judges listen to the law and the defenses, there are a lot of defenses to them if the employee can afford to fight.
Donna, believe it or not, we're rounding out our time together on
Oh,
here.
gosh.
But, I'm sure there are so many of our listeners who are addressing what we brought up today in their own lives. How do they reach you?
Well, my website is ballmanfirm.com. That's BALLMANFIRM.com. That's my firm's website. You can also check out my blog, Screw You Guys, I'm Going Home. And that has also information about how to contact me if you have questions where you don't need legal advice, but you just have like a general question and you don't mind me answering it publicly. You can ask me a question there or look at my column. And I'm also on Twitter as @employeeattorney. So you can find me
pretty
out
much
there.
find
How about a phone number?
Oh, sure. 954-680-6300.
Repeat that, please.
954-680-6300.
Donna, this has been a fascinating conversation, and we could continue it for a long time because you're such a knowledgeable person, and there are so many it's like a Pandora's box. Once we started to open it, and then there's this, and then there's that, and all of these inherent enigmas. Yes, you can be treated, but you may be violating your company's drug laws. So it sounds like, for the moment, Charlotte's Web or medical marijuana should only be used by those who no longer are employed.
I'd say, look, when in doubt about your rights, talk to an employment attorney in your state. Don't call me about something from New Jersey, but if you have a Florida employment issue, talk to a Florida employment attorney, and make sure you talk to somebody on the employee side.
All right, well, South Florida, America, and the world, you kind of heard it here first. Donna, that was a fascinating conversation, and I think the medical marijuana issue going forward is just going to be fraught with all kinds of issues. Paul?
Caregivers, have a great week, and please take good care of yourself. Thank you for joining us, and look for us on Facebook.
Right. And calling in.
Thanks for joining us for this week's Caregiver reality show. Each week, David Levy, a gerontologist, and Paul Vadiato, a caregiver expert with a combined over 25 years of experience, providing practical and realistic help to caregivers struggling to keep up with the needs of a loved one who are unable to care for himself or herself. To reach David Levy, email him at david@caregiverreality.com, or to reach Paul Vadiato, email paul@caregiverreality.com. And find out more online. Just go to caregiverreality.com. See you next week for another exciting show of Caregiver Reality.